one of the condition when in a good busy ICU always one patient or two will be present is an acute pancreatitis. These patients classically present with a pain abdomen which radiates to the back, and when a patient of acute pancreatitis comes in the ICU, you really don't know when this patient is going to get better, particularly the acute severe pancreatitis. So let me start again discussing with Dr. Manav Vadhavan, who is the senior gastroenterologist, hepatologist in the Department of Gastroenterology and Liver Transplant at the Fortis Escort Hospital, New Delhi. Dr. Manav, in 2017, how do you diagnose acute pancreatitis?
See, the diagnosis of acute pancreatitis has been constant. So it doesn't alter in 2017 also, I would say. Appropriate clinical scenario with 3 times raised amylase and lipase. So appropriate clinical scenario is a pain abdomen, severe pain abdomen, may or may not radiate to back with a raised amylase lipase. That is a clinical diagnosis of acute pancreatitis, and it has not changed for ages. Where we falter is, we see amylase lipase raised with a mild pain abdomen, no tenderness, and we forget that this patient has renal failure. There may be other causes of rising amylase lipase. So that's where we falter.
So, but many a time the diagnosis is not clear. So what is the role of imaging in these patients?
I would say 90% of times, clinical and biochemical parameters will diagnose pancreatitis. In 10% of cases, you may still be in a dilemma. You may be still thinking whether this guy has a perforation or some bowel cause, and your amylase lipase are high. In that case, you need a imaging like a CT scan.
What should be the level of amylase or lipase, and which is more specific?
See, 3 times, and lipase is more specific. At least 3 times raise.
But there are a lot of confounders where amylase, even in sepsis patient, you can find the amylase.
I completely agree. I completely agree. So you have to take into account the clinical picture. If there's a patient in the ICU who is otherwise sick with a comorbid disease, and all of a sudden you find a rising amylase lipase, you probably will desist from diagnosing acute pancreatitis. On the other hand, somebody who is up and about doing his job and comes to you in the casualty with a severe pain abdomen with rising amylase lipase, you diagnose acute pancreatitis. So that's the background of how that thing has evolved.
And